Okay, Simi, you can go.
Yes, we are live.
Yes. With the total number of coronavirus infected patients in India rising up to almost 3,25,000 has underlined, underscored, and highlighted that these are truly unprecedented and extraordinary times. So amid this pandemic, global lockdowns, and growing economic uncertainties, there has been an upsurge in the cases of domestic and intimate partner violence in the household. With the men, the spouses, brothers-in-law, fathers-in-law, all locked up within their households, either after having lost their jobs or are working from home, the women in the homes have found themselves in a situation of despair. With the pandemic looming large outside the home, inside the home, there is a threat of domestic violence. On this note, I, Simi Mehta, CEO and Editorial Director of IMPRI, I wish all the participants a very good evening and extend my heartiest welcome. Today, we have all gathered here to discuss and deliberate upon the chronic and pressing crime of gender-based violence unleashed upon by the women, on the women by the unabashed and patriarchal and male chauvinistic social order. Impact and Policy Research Institute, since its inception, has had a deep interest in pursuing evidence-based research to foster gender equity and equality. Towards this, we have had our voices recorded through multiple projects and numerous publications, both in print and electronic media, and we have discussed the need for a multi-pronged approach to uplift the women from their situation of personal, social, economic, and political misery. With an active interest and involvement of a number of our mentors and advisors, we have instituted the Gender Impact Studies Impact and Policy Research Institute. It is under the auspices of this center that the Web Policy Talk this evening is being held. I'm delighted to inform you that we have the support of GenDev Center for Research and Innovation, Gurugram. It is led by Professor Govind Kelkar, who is also the chairperson of IMPRI's Gender Impact Studies Center. Today's Web Policy Talk is chaired by Professor Kelkar herself, whose several decades of work has been devoted on gender relations, political economy of land rights, women's movements, and their comprehensive empowerment. She has written over 16 books and has contributed numerous articles in research journals of national and international repute. Professor Kelkar has held several eminent positions, both nationally and internationally. She has been a senior advisor to Lendlease in Seattle, USA, senior advisor at the Economic Empowerment Unit, UN Women South Asia, professor at Council for Social Development, among others. We thank you, ma'am, for accepting our request to chair the session today. I'm also excited to introduce to you the co-panelists for the day. We have with us Dr. Manorama Bakshi, Senior Advisor, Tata Trusts, and Honorary Advisor, Research and Collaborations, IMPRI. Dr. Bakshi is a social development and public health professional with over 2 decades of experience in offering techno-managerial support, strategic planning, and advocacy support to the governments, multilateral organizations, corporate houses, and philanthropies. Her professional and research interests include gender, HIV/AIDS, human rights, and sustainable development goals. She has also published numerous articles in reputed journals and media platforms. We welcome you, ma'am. We have with us Ms. Suhela Khan, who is currently leading the WeEmpower Asia program at UN Women to enable women to access business and leadership opportunities in the private sector. Her expertise lies in areas of program development, monitoring, impact assessment, and partnership building. Through all the work that she does, she aims to integrate the feminist principles and strategies in programs to enable women to recognize and challenge discrimination and gender-based violence. She has closely worked with national and state governments and has edited several publications on gender equality and women empowerment. Ms. Khan is also a Ford Fellow and holds a master's degree in public policy from University of Michigan, United States. Welcome, Suhela.
Thank you, Simi, and my good evening to all co-panelists today. Really look forward to the webinar.
Thank you. And we are delighted to have Dr. Indu Prakash, ground level social worker, an activist, a feminist, and a vocal advocate of the rights and dignity of CityMakers, as well as of the Beti Zindabad campaign. He has had a deep understanding of the convergence of gender identity and the associated challenges. Dr. Indu Prakash has represented India at various national and international platforms like the United Nations General Assembly, Institute of Global Homelessness, etc. You all must in fact have recently watched him as a panelist in several news debates on the ongoing health crisis compounded by the sheer greed of private hospitals and police brutality. Dr. Indu Prakash is the author of several books and is a frequent contributor to print and e-media. We welcome you, sir. I now invite Professor Govind Kelkar to formally begin the session. I request your permission, ma'am.
Ma'am, you need to unmute yourself.
Yes. Can you hear me now?
Yes.
Okay.
Yes, ma'am.
Right. So thanks so much, Simi, for generous introduction, and good evening, everybody. I thought that so much has been written in media, and we have been all been reading about the gender-based violence. So I would really like to establish a link between the two, which have recently increased. One is really the increased care work, and then the increased domestic violence. What is there any relationship between the two? And that would be my purpose, and how bad situation is in India in the international framework, because this has been also global situation. So according to ILO 2018 report, can we put the slides, or I can go ahead without slides, Simi?
You can have the slides, ma'am. Ma'am, would you like to
have the slides,
or would you like to see the presentation from IMPRI and then make your detailed remarks?
I think that would be, I was planning for that, but since you called me, so I was just thinking that I would like first IMPRI to go, and I was just thinking that why this sudden change. So Simi, please go ahead.
This is just for your permission to start the program formally.
Of course, no permission. Very, very pleased, very, very extremely pleased. Yes. So Professor Balwant Singh Mehta.
Yes.
No.
Since
Yes. So, sir, I am beginning, Professor Balwant Mehta, I am beginning to just introduce to the audience and the panelists about Impact and Policy Research Institute, which is Government of India recognized startup think tank and has been incubated by Nexus through the IC Square Institute and supported by the US government. The main aim of IMPRI is to specialize in policy research, impact assessment, monitoring and evaluation. And we have various verticals of our work, which is divided into economic development, governance and environment. And we have a whole network of diverse and credible research professionals from various fields of study. So the basic three types of objectives that we activities that we deal with is building dynamic evidence, deepening public debate, and catalyzing transparent and accountable governance. Next slide, please. Next slide.
Yes, ma'am. Just a second.
So among the 7 centers, we have 7 centers at IMPRI, and among the 7 centers that we are engaging with is the Gender Impact Studies Center. And as mentioned previously by me, Professor Govind Kelkar is the chairperson. Next slide. And under the center, we have undertaken some research projects and some very pertinent articles that we have contributed to the print and electronic media have appeared. This is there on the screen for you. One was published by the Observer Research Foundation portal. The other was in the Pioneer, the daily newspaper, and the other was the India Development Review. In fact, the India Development Review got back to us and said that this particular article has had 12,000 views, and I urge all of you to look at this, and we welcome all of your feedback. So it is mostly related to how domestic violence has been a forgotten agenda while the decision to lock India down was being taken, and how global pandemics, normally impacts domestic violence, and it is usually seen that domestic violence and intimate partner violence cases are on the rise during these health crises. Next slide. Yes. So, Balwant sir?
Yes. Hello. Actually, the screen is something. Hello?
Yes, sir.
Screen.
You can't see the
so
screen?
Paper is coming on the screen.
Next slide.
Next slide.
Hello? Yes. Okay. Fine. And good evening to all of you, and I welcome all the panelists and all other IMPRI officials. So actually, today we are just discussing what Simi just explained, and mainly the gender-based violence in the current ongoing this crisis period. So the main first, I would like to highlight what exactly the facts all over the world globally and where India stands on this gender-based violence. So first, actually, the violence against women, actually gender-based violence, continue to be one of the most prevalent and least recognized human rights violations. In the past, it has been experienced and well documented that in the time of crisis and unrest, the incident of violence against women has increased manifold, like we have seen in the past and well documented in the case of Ebola outbreak hit in West Africa and in many other cases. Similarly, in the current crisis, is the novel corona crisis. There are already reports coming from various countries across the globe. They are suggesting an increase in domestic violence. So let me first start with the facts. What exactly I've not given here the detailed facts, what globally is globally presented. Is like every 26 minutes a woman is molested. Every 34 minutes a rape takes place. Every 42 minutes an incident of sexual harassments occur, and every 93 minutes a woman is burned alive for dowry. So if you see in this context, so gender-based violence, what WHO shows, is 1 in every 3 women across the globe experience some kind of violence, so it's like physical or sexual violence in their lifetime. And 243 million will, during the last 12 months, experience the same. This is UN data. And then next, the Indian latest data on from NFHS, National Family Health Survey, shows that 1 in every 4 women face domestic violence in the country. 1 in every 4 women. And 1 in every 3 married women between the ages of 15 to 49 experience physical and sexual violence, and 8 out of 10, this is a very serious thing, that such women reported that their current husband as the male perpetrator. 1 out of 2 women between the ages of 15 to 49. It is very surprising that our view that violence by the husband is just available in a variety of situations, like neglecting the household work, or the children, or going out of house without the permission of the family head or husband. So these are the kind of thing which is reported. But again, these data is widely unreported because of several reasons, which I think everybody knows, that women feel unsafe while approaching the police, and because of orthodox social norms and stigma. Next, please. Next slide. Yes. So as I said, even Simi also said this thing. Like this. Next slide. Yes. 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 So
Please be a bit.
like, yes. Okay. So what happened globally? If you see during the last 2 months, if you see all across the world, like France reports domestic violence have increased 30%, Argentina 25%, Cyprus and Singapore 33%. Similar kind of reports if you see from Canada, Germany, Spain, United Kingdom and United States. So not only in India, but across the globe, because of this lockdown and social distancing norms, they stay with their perpetrator at home. So these kind of things. So this reportage has gone a lot during the last 1 and 2 months during this crisis period. So similar kind of data also reported by NCW India. Obviously, this report is very underreporting is there. But if you see from January to May, the number of reports has gone up almost more than 4 times from January, so 271 to 914 for domestic violence cases. And in percentages out of total, it has gone from 18% to around 50 to 55% out of total reported cases. So this is the kind of thing which has been seen all across the world and even in India. So this is a debate all over the going. What exactly the situation? Why this kind of thing is happening? Why the policy, the government and other relevant stakeholders are not able to stop this kind of domestic violence against women. So these are the some kind of suggestions, some kind of practices, innovative practices people are using. One is we need aggressive campaign, national-wide campaign, like for the coronavirus safety. We are continuously running these kind of things. But for this domestic violence and violence against women, we are not able to do similar kind of awareness regarding this. And there are some bell bajao. Bell bajao means there are. So if you see the suspect of domestic violence, so anybody with, like, if you know that you can use the emergency helpline number, or after recognizing the domestic abuse or something, you can report to the nearby women center or women commission number. So these are the things which is one of the important aspect. And there are strong messages from the enforcement agency, like whoever it is. Then the last is classified as essential services, like the other services. So if the innovative practices happening in some of the countries, in European countries, like the pharmacies are being trained to identify people facing abuse through code words. Asking for mask 19 is being used as a code for people who cannot speak openly to indicate that they are being abused and are seeking help. So similar kind of, like in a grocery shop or some kind of pharmacy, this kind of thing, this kind of innovative practices can also be taken in India. So Simi, I also go on this. Okay. Well, some of the questions which we are thinking the panelists should focus on, and obviously it can go beyond this. That why this sudden spike in cases of domestic violence across the world and also in India? Is isolation playing a major role? is the rise in domestic work burden and care work. What Professor Kelkar just said, for both working and non-working women, is also an important indicator for conflict and violence, increase in conflict and violence. And what are the what is the association of this increase in gender-based violence and other factors like poverty, low income, social norms, and alcoholism, women's employment, and other factors? What are the steps the government and other related organizations have initiated? What more needs to be done? And what are some of the best practices in the world adopted by other countries to stop gender-based violence? And we can take a lesson and do this. So these are the kind of tune I think the panelists will discuss about it, and then we can go forward. And thank you very much. Yes, Simi, over to you.
Thank you, sir. The next part of the presentation would be made by Anshula and Anshula Mehta and Ritika Gupta.
Yes, thank you, Professor Mehta. Thank you, ma'am. So while the statistics certainly represent an overall picture, it is also individual realities that kind of jolt us out of our bubbles and give us a sense of the kind of suffering and despair that is rampant among persons who have survived or are living through gender-based violence. We are sharing with you a few real stories as reported during the lockdown, with names of the survivors being changed. 2 weeks ago, BBC Telugu reported one such story. On 18th April, Tara went online to search for helplines for survivors of domestic violence. It was a little more than 3 weeks into India's lockdown, which began on 25th March. Her husband of 15 years had always been abusive, verbally, emotionally, and at times even physically. But she had her job, which kept her out of the house for most of the day, and her husband often traveled for work, which kept him away. The lockdown, however, changed everything. I live in a constant state of fear of what could affect my husband's mood, Tara narrated over the phone in a low voice after locking herself up in a room so her husband and mother-in-law wouldn't hear her. She says both of them taunt and harass her. I am constantly told I am not a good mother or a good wife. They order me to serve elaborate meals and treat me like a domestic worker. Unable to bear the abuse and the beatings, she decided to seek help. She found a Facebook page run by Invisible Scars, a support group, and contacted them. We have been receiving numerous complaints seeking help, says Ekta Vivek Verma, founder of Invisible Scars, who spoke to Tara. She says she laid out all the options available to Tara: register a police complaint, seek legal separation, or even talk her husband into going for counseling. Most of the time, women don't want to leave an abusive spouse. They ask us how to teach them a lesson or make them behave better, Ms. Verma said. That's because of the stigma attached to divorce in India. Few families would support daughters who want to walk out of abusive marriages, especially if they have children, as Tara does. And leaving to go stay in a shelter or with parents is especially hard during the lockdown when transport has been limited. Tara says she warned her husband she would go to the police, and the abuse stopped for a few days but started again. Leaving, she says, is not an option. Only God can save me, she adds. I can't trouble my parents and my young child.
Thank you, Anshula, for your story. This is another story of Gulab Sa report. Hanji. This is another story reported by Logical Indian of Lady Gulab Sa. The name has been changed. The lady got married at 19 and got to know that her husband is an alcoholic only later. Living in Kanpur, Uttar Pradesh, this 24-year-old domestic worker and mother of two already wishes her husband gets back to work immediately so that that is her children and she, can live at peace. She recounts, now my husband stays at home. Earlier, when he used to work at the factory, he would return home in the night drunk. There wasn't much issue then, as he would come home tired and sleep. She further adds, she thought things would change for her. That's why she started working as a work, domestic help in a nearby colony, barely 2 kilometers from her house. She wanted to start earning for her children to eat every day and with the hope that they don't need to depend on that alcoholic. But lockdown has thrown them into their worst situation. She's counting days till the lockdown gets over. Not a day goes by when her husband won't abuse her or their children. I request Simi ma'am to take the stage, please.
Thank you, Ritika, and thank you, Anshula. For me personally, listening to these stories brought goosebumps. I am sure the audience and the panelists must have some thoughts on similar lines. With this presentation, and before I hand over the stage to Professor Kelkar, I would like to speak a little bit about the center, the GenDev Center for Research and Innovation, which she represents. And she is the Executive Director and CEO. The GenDev Center for Research and Innovation has been founded with the vision of the reality that all women and girls have the freedom, equality, dignity, and economic independence. And going by this vision, it works to ensure that all the women and girls have agency and capability and institutional parity in asset ownership, rights, decision-making in the family, community, polity, and the economy. The overall purpose of GenDev Research Center for Research and Innovation is to set up the women's movement through feminist research and policy analysis. For this, it conducts research and innovative programs in the areas of gender systems and transformational social change, social, political, and economic analysis in development, climate justice and energy transitions, globalization, knowledge and inequalities, advocacy, programming, and evaluation of social, economic, and technological systems. In its small span of its existence, it has undertaken several research projects, and the entire center has engaged in a number of publications, and that has been published at various reputed research journals. So with this background of GenDev Research Center for Research and Innovation, I now invite the chairperson for the same, Professor Govind Kelkar, to make her inaugural remarks. Ma'am, the floor is yours.
Thank you, Simi. You can hear me now. All. So I would start with what by mistake, I started earlier, that I think enormity of the violence against women is well explained by Professor Balwant Mehta. And later, I think people are going to talk, particularly Suhela Khan, about the shadow pandemic of violence, which has been created in this kind of pandemic situation. So I would not go on the numbers because we have been reading reports, but I wanted to really ask question that to myself and in this presentation and to others that we need to address, that how much care work women are doing in India, and that means they are food provider, they are care provider. Then why there is an attack on them within home and outside? We are here addressing domestic violence, but once the lockdown is over, I'm sure that the people will not all of a sudden become non-violent, this violence outside the home also would continue. So this is a serious kind of issue, and that's why we should address this as a kind of major social kind of issue. So according to, can I have the next slide, please? So according to ILO report of 2018, women in India spend 312 minutes a day in urban areas and 291 minutes a day in rural areas doing unpaid care work, that is the washing, cooking, cleaning, taking care of children and elderly. And men correspondingly spend only 29 minutes a day in urban areas and 32 minutes a day in rural areas. And what is even more unjustified about this work, that this kind of unpaid care work, which takes enormous amount of women's time, is not recognized as work. It is seen only as a woman's duty. It is not even considered work. And some people, when they start talking of the work, economist for long has called these are the chores. And that's why I don't use the word chores. They said that these are the tasks and these are the activities. So in most of the household, girls are trained to accept work. Why women accept this work? As a feminine duty. And in this duty, if they think that they have not really well performed their duty, they can be subjected to violence, and to some extent, half accepting that kind of violence as a justified way. This is the answer to one of the things that was presented earlier, that how many women say that, okay, he is my husband, so what, he beats me, I mean, he also loves me. That is the question. So both women and men are affected by coronavirus. It is not that men are not affected in terms of the loss of jobs and increased poor health care and question of migrants. We have all seen the frustrated financially in a kind of most miserable cases. But women in very significant numbers are at the center point of this impact. And men I see as both as victims of coronavirus, and they are also perpetrators of violence. So that is one thing that here lies the gender difference between the two. So by drawing attention to the kind of gender-based violence, I'm not saying men are not affected by the kind of gender-based by the coronavirus, but it is much more that women are affected. Next slide, please. How so? This care work has existed. Let me get a glass of water. Okay, this has existed before pandemic, before the coronavirus or COVID-19 attacked us. And the government of India in coronavirus has actually widely appreciated it is widely appreciated, government India, for its stringent measures of the lockdown in various areas of the country. Of course, these lives have been saved. The lockdown has saved numerous lives, but at the same time, people are deprived under poverty line, both women and men, mainly migrants, casual workers, daily wagers, and their livelihood affected, and institutional care, food, dignity. Many of them, however, have managed to reach home exhausted physically and financially. Few died on the way also. But how it has increased women's work? Because they could not really take rest. They had to provide food and care to those who were exhausted, for which we don't have much data. We can make intelligent guess. The closure of a school has increased the child care responsibilities, and inaccessibility of the hospitals and healthcare centers, and the absence of hired help has further added to women's care work commitments. So this is how the increased factor that is coming. So normalization of the unpaid care and unfreedoms of women is indicative of the low socioeconomic concern of women, ineffective laws, patriarchal structures, masculine policies and practices in our society. So this is the kind of package that women are dealing with it. The laws are there where they are ineffective. There is a low socioeconomic position of women. And there are masculine policies that really repeatedly say that men are in the dominant position and women are the followers. And there are numerous examples of this. One can give that. So generally, women trapped in the market-centric logic of work, that what is all or most of their 90% of their work that they do at home, whether they are in the paid work or unpaid work, they are not, that work is not recognized as work. They exist under the state-led economic dependency of men, head of the household, and otherwise economic dependency. And as well as under the influence of gendered social norms, how they should be confined, how they should provide care, food, and there should be that they should be perfect. There should be no flaws in that. So women feel very limited in bargaining to the head of the household and outside. And these people who are consumers of the product of their labor. And this is Nancy Folber has recently called the care. The political economy of care work. That is the very interesting so-called care theory of the COVID. However, this has also resulted in the disproportionate burden of the unpaid care work on women of the household. So two worst outcomes, as I see, of the pandemic, among the others, are really a rise in income inequality and increased domestic violence against women. So these are the kind of two major factors come when we deal with this question. It doesn't mean that poverty and inequality has not. It comes under poverty, it comes under inequality. But when we put a gender lens, then we see only these two kind of major outcomes of adverse outcomes of the pandemic. Next one, please. Next slide. So what about healthcare and health workers? So I have been following the cases of ASHA workers, and I'm surprised that we have known that how poorly they were paid and what has been their critical role during this time in the rural areas and how they have been threatened, including the threat of the rape and sexual attacks on them. Majority of them, they come from marginalized social groups, Dalits and Adivasis, and they are in a cycle of delayed payments, rising expenses, and debt cycle. This is their own words that they say, that this is the cycle we are dealing with. They are not being paid by the state government or by the central government. They are just kind of passing the buck to one another. And they suffer from malnutrition as kind of in terms of food distribution, discrimination from the early age, but because being a woman, but it has increased now. Some of studies have pointed out that more men have died than women in COVID. But a new study which came out very recently in May 2020 by the Institute of Economic Growth, Delhi and Harvard School of Public Health, TC Chan, they studied a sex-specific distribution of 3,433 deaths among 112 plus 27 kind of coronavirus infected patient in India. And they came to the conclusion that women and girls in a certain specific age group have a high mortality rate, relative mortality rate. So this is important. Our research earlier also had been very kind of gender specific or gender biased. And there is no kind of reason that it should not be really seen more. We need to do more research in this situation. Next one, please. Next slide. Something about domestic violence and what are the, as I said earlier, I am not going to that how many cases have increased. In fact, only death had been presented very well by Professor Balwant Mehta. But in China also, among the wife beating and hitting recent cases, the feminist voices from China, and particularly younger people and including some men have pointed out that out of the violence cases, 90% are hitting by husbands that women have reported, 90% as high as that. So we are really at a loss to understand Why for women, homes have become a sphere of fear and anxiety. The home which is considered, we grow up as the nurturing home and we go exhausted and all this kind of thing and we roam. But for women, what the Gulabo said, or what was the Gulaba said, that I'm just waiting for the time when he returns to work so we children and I feel safe. That was the kind. So it has really become a sphere of fear and anxiety. That is important. What kind of home we want to create where the people can have food and care or do not have, or they should be subjected to intensified domestic violence. Second is also, are we living in in a age where masculinity proudly parade itself as a sovereign authority? Then they do not have really, women do not have any voice and they have to be economically and otherwise dependent. This is the question as civil society members we should raise. Next slide, please. Now, if you say why it is this condition, it is not that it has all of a sudden come during Corona period. We see our analysis of the gender system in India indicates that women and girls have multiple forms of unfreedoms based on as a basis of sex and gender. And the major ones are women's economic dependency on men. They don't have house, they don't have other resources in their name. So it's almost the assetless position, lack of rights to decision making and building economic and social agency, and limits to mobility. Again, there are boundaries for women. They have to be home. If they have to be outside, they cannot have the purpose. They have to show the purpose. They quietly will go to the market, buy something, and not hang around. Hanging around of young women is considered unworthy. That is even in Delhi and Bombay and city like this. In excess of finances and markets, violence or threat of punishment, disallowing any transgression of or deviation from social norms. So these are the kind of unfreedoms that women are trapped into. So, and what is the naturalization of men? They have the hegemonic power over women's body, work, and that is justified in the character of male as the breadwinner and head of the household, and legal and socio-cultural norms. It is not only social norms, it's very much legal norms also. These are development norms also. So of course now World Bank is debating that head of the household or the man as the breadwinner have lost their relevance, and that should be really that should be done away with. So we should do away with this kind of head of the household, but still it is kind of China. In socialist China, it was not there, but it came back when it became a part of the development system. And this dominant role of men, what I call it, is manufactured out of the discourses on poverty, growth, class, caste, and more recently also in the impact analysis of the COVID. How many people are really looking at the gender specific kind of distribution of what are the impact on women, what are the impact on men, that they are not looking at as a general impact. And in the generality, the those who are poor, those who are invisible, that is lost. Next one, please. So my attempt is to understand, I think that is the last one, and I will not take much time. So let's see that there is an intensified domestic violence that is not captured in the conventional analysis, either by economic or social analysis, even of the pandemic. So what we need to do, we really need to raise hard questions. Why do the consumers of women's labor engage in an exercise of abuse and physical force? And why women are denied any agency or the existence with dignity? If agency becomes kind of thing, this is the whole question of dignity. And what has been the role of the state and the market that thrive on women's unpaid and underpaid work? This is from this perspective, I wanted to really, my framework analysis had two interrelated components. I want to continue with the study, so it is just the beginning kind of thing. There has been increase in women's agency. These are the two kind of reasons I find for this. As a result of their significant work over 20 years in food production and other subsistence income earning work, in unpaid care work at home, in particular numerous women's rural organizations, self-help groups, their participation in rights-based movements like Pink Brigade, and you must have said Pink Sari Brigade kind of thing, RO, Land Rights Movement, Shaheen Bagh, everybody is familiar with. These are the international movement, and many others. Deccan Development Society recently got something. So women's group have been recognized in terms of this agency is being recognized nationally and internationally. And second is men's assertion of the male power. When they found themselves at home for 24 hours, watching and realizing what had changed in women's thinking and doing. And doing, I call it thinking, and doing is the agency. And as a consequence of their kind of shrinking masculine power over women's body and work. So men, earlier they did not realize, they work and they drank as was supposed, and they came back and they slept. Now they are observing women in being very capable and handling all these things, and they want to reassert this kind of male power, which is they think is slipping out of their hands. So, last month, please. So gender system and the male power. Power works through arrangement of relations between individuals, and that moves directly, goes down into society. We have seen through history that women and their punishment by this have affirmed the supremacy and sovereignty of the male. Foucault's, I liked reading Foucault very well at this time. He shows that how the legal frameworks do not work for women, the punishment kind of thing. They are not represented there. It is someone else is deciding. It may be the man, it may be the kind of very masculinized women, if one or two are there. So if they fail in their duties, and they fail in their servitude, then they are punished for that. And there is a constant instilling of fear through discrimination and cruelty by punishment, which is part of the political relations. And in this case, we can call it gender relations. So women and their deviations from social norms, which they justify as a matter of their rights and justice, is attacked. It is under investigation, depends on the male-dominated system within the household, outside the social structure and institutions of power. So laws are made, but they become ineffective because of this particular thing. These social norms and political or legal systems are changing, of course, and there are some men who are kind of bothered by this kind of violence. It is not only three men like Balwant, Arjun, and my old friend, I'm forgetting his name, Indu Prakash Singh. I mean, there are more men also like him, like them. So that, but therefore, the increase, they really question the increase in violence against women, and this is considered even in China. I was surprised that how the young people have formed kind of a brigade, and feeling ashamed of the Chinese. In this, China is being so controlled. We are moving toward that, but we are still better than that. But even in China, they have formed these brigades which are questioning this kind of high violence against women. So agency is something that we need to study, that why the kind of agency of women is somewhat recognized lately by women and some men. However, we have a long way to go, but we do not have the time really to wait. We need debates, we need discourses on this, so that we come to a kind of both action and the policy we need to change. Thank you very much.
Thank you, ma'am. Thank you very much. Yeah, thank you very much, ma'am, for running us through a wonderful presentation and your thoughts and the studies that you are undertaking, where the perpetrators of the crime of domestic violence, in the garb of health crisis looming outside, where you have pointed out that the relative risks of catching the disease, coronavirus disease, is relatively higher for women and girls, and the internalizing of the work environment, the household tasks, as you mentioned, needs to be underlined. And thank you very much for pointing these out. I'm sure it will stir up several points of discussion over the course of this panel. I would also like to just extrapolate some of your arguments in a couple of sentences, where when you mention about the status of men, where they have assigned the high status to themselves and they have been removed from the whole drudgery of household tasks, and they have enjoyed the whole long uninterrupted hours of leisure. And in these leisure times, they have had the opportunity to create art, philosophy, literature, scientific discoveries, which women have been kept away from for most of the history. Actually, it also brings me to question whether women have to really earn their time of leisure, or say, for example, after at the end of the to-do list for the entire day, or which definitely never ends. So this is definitely a feminist issue of creating a whole culture and history of leisure. So thank you so much, ma'am, again. And I now seek your permission to invite our panelists.
Not my permission. It was a request that you will coordinate.
Okay.
Thank you, Simi.
So
yes, please go ahead.
Thank you. I now open the floor for panel discussion, and we have our eminent three panelists present. I would request Dr. Manorama Bakshi to go on first, please. Ma'am, over to you.
Thank you so much. Thanks, Simi, and good evening, everyone. Thank you so much, Professor Kelkar, for this presentation and raising some of the very, very pertinent issues. Saying so, whatever I will be speaking today, it will be mainly based on my observations, based on the one-to-one interactions, telephonic interviews with ASHAs, ANMs, SHGs, going through the IMPRI report, and then following on that. Some of the international webinars I have attended, some of the webinars that Tata Trust had conducted. Necessarily, whatever my views and whatever I'll be speaking, it will be mainly like my views, whatever I have gathered, and not necessarily the views of the organization I work for. And saying so, I would like to bring your attention, ma'am, to the recent research. It's not very recent, but Copenhagen Consensus Center has said that the impact of gender-based violence is 25 times when it comes to the cost-benefit analysis now, 25 times more than the wars. So you can imagine the impact of the violence or gender-based violence overall economies. And it is very well mentioned that gender-based violence to a very large extent, it has impacted up to 2 to 3% of our GDPs. Today we are talking about GDP, GDP is this much, that much, it's coming down. But simple one thing, if we can hold and if we can control, if we can tame our people, men at homes, not to indulge into gender-based violence, I think to a very large extent, ma'am, it will be a big win. Now saying so, I mean, if we will look at all the evidences, like Anshula gave some of the wonderful examples of interactions with people. I will share you, these are some of the startling discussions I had with people. One is that a lot of NGOs and SAGs have spoken to me and they said, when we are trapped, actually, they said they use the word trapped. When we're trapped with the males at home, I mean, we wish to run away, but these are the times when we can't even run away. And based on these, ma'am, I mean, it's not for the first time. What I have seen, like the evidence, when we will go into the epidemiology, because whatever I'm talking about is based on the public health and epidemiological surveys. It has always seen, our minor studies have strongly sort of advocated that these kind of gender violence does spike up whenever these kind of epidemics or pandemics or disasters happen. So we have to think very deeply, as you rightly said, about the socio-psycho norms, why this thing is happening, deep-rooted and deep-seated like gender-based disparities, not only in our societies, but definitely across all the religions. I mean, recently I have gone through some of the very big names in gender. They talk about that only certain religions are, having the disparities, but whatever I have studied, I see it is across all the religions. And I feel, ma'am, I don't think that our gods would have ever thought of like women being 50% of the population and being not equally developed as men. I don't think any of gods would have thought that way or can ever think that way. And none of the countries can develop equally if our 50% of the population is lagging behind. Saying so, ma'am, I mean, I feel that gender violence and the gender, it has manifested and it has so much interconnected with so many other things. Like it's connected to education going out of the school, because when I was speaking to some of the NGOs who are working on adolescent girls and those who are working on women, they said that post-COVID, there will be a lot of child marriages. We will see spike in child marriages. We will see spike in girls being drawn out of the schools. These are some of the ground facts that, that we need to address. And if something of this sort happens, madam, whatever we have worked, whatever we have gained when it comes to, gaining on the maternal mortality, gaining on the infant mortality, gaining on the under 5 mortality, gaining on the immunization indicators, overall indicators that India is visualizing, gaining on the TB, what India was thinking that we will be ahead of the world and we'll reach out by 2022, we'll be TB Mukta Bharat. So these are the challenges, these are the public health challenges, which I as a public health person see what will happen if things are not sort of controlled and contained at this. What I could make out of this, lockdown things, lockdown 1 and lockdown 2, I think it was April 11. April 11 is Motherhood Day, wherein like all the ashas and everybody, ANMs, government ministry used to sort of honor them. But unfortunately, like since we had the lockdown, this thing didn't happen. But I, as a practice, I called up like the ashas and ANMs in Kalahandi in Odisha. I called because I have been traveling across high priority districts earlier, like, so I called some of the ANMs and ashas in Dholpur. I called some of them in Sarguja, and just to seek and ask them, those who had got the best asha awards kind of thing, kaisa chal raha hai, kya chal raha hai, and all that. And I mean, you can make out like from them, like the extra burden they have. Otherwise also there are loads of work. Yeah. Now with this COVID, I mean, they have added the extra burden on them. And since the resources are now going into the COVID expenses, like till lockdown 1 and lockdown 2, when we talk about the essential maternal services, like we are talking about antenatal services, we are talking about intrapartum services, postnatal services, and the main concern is, ma'am, anemia. I see anemia as biggest challenge to India. I mean, anemia is linked to so many disabilities, and not only disabilities. In 2013, Government of India came out with RMNCHA, Continuum of Care. And that actually has gone, I mean, whatever gains we had earned because of this RMNCHA and continuous circle, like right from the adolescent age to reproductive, to maternal, to newborn, to child, and again going back to adolescents. This lockdown have impacted on those kind of things also. I spoke to these ashas and they said, ma'am, no one comes. It's not that the services are not there, but people are also fearing. Number one is that a lot of resources have gone into the COVID care, with the result like the ANC care, what we talk about the anemia or registration of ANCs. I mean, these are the big issues. India is the country with birth cohort of like 2.8 crore females. Now, 2.8 crore pregnancies every year. 2.8 crore pregnancies means that if 2 or 3 months are sort of like shut down with the services, it does have huge impact on overall women's welfare, women's development. One thing is that. Second thing, I heard from a lot of like NGOs that there have been spike in the, telephone calls. They would hear a bell ringing, but then it would cut there and then only, which definitely indicates like that maybe someone wanted to reach out to them, and maybe because somebody at home, what Arjun has mentioned, like the predator is at home. In one of the articles I have read it, and the caption was very nice. It caught our sort of like abruptly, like sort of we got up out of slumber by reading it. You are staying with a predator at home. So when predator is at home, definitely like you can see these kind of things happening around. And a lot of people have reached out to us, said that probably these call drops may be the reason that someone has not allowed them to speak. So that is another big challenge that our females, digitalization is a big issue. So I would suggest that either, because if you will talk to these females on ground, I mean, they say that mobile to hota hi nahi hamare paas. And otherwise also it is just that only 40% or 39% of the females have the mobiles. And that too, they have only not Android one. And that too, in most of the mobiles, it is only incoming calls they receive, outgoing calls they cannot make. So that is another big challenge. And we have to look into, like, a lot of the females have again said that, I mean, I'm giving you the example of one of the principals of the college. Can you imagine? I mean, I just spoke to her and we are talking about empowerment, educational empowerment. She said that she's fearing her husband so much that whenever he comes home, I just lock myself in my room, keep all the food and everything outside on the table. And we are today talking about empowering women. We are how much deep-rooted and deep-seated these patriarchal structures are, and how much we have to do not as policymakers. Somewhere we have failed. I'm not talking about India only. Definitely, India has huge challenge because 90% of the females are in unorganized sector. Their wages, their employability is a big issue. Then if you look into organized sector, again, then there's a big challenge. For when we look at the women labor participation, it is just 24%, 25%, while as world over it's 48%. How it is justified? These are some of the challenges which I see, and I think that we have to strongly do something. We need to have proper protective measures for the Ashas. I mean, the way you said that spike in violence against Ashas and ANMs and the field workers, even though now government has come up with insurance for them, like 50 lakhs for each of them, like almost 24 lakh ANM Ashas and community mobilizers. But again, if we look at the kind of amount of work and the kind of risk they are facing, they don't have PPE, they don't have the proper goggles, they don't have the proper kind of gloves. And recently there was somewhere we had heard that when in some of the big metros, they were offered to stay in their 5-star hotels, medical fraternity. Unfortunately, the doctors were the first one to go there, while as the Ashas and ANMs, which are almost you can say 13-14 lakh across India, and such a huge population of women folk, they are not allowed to stay there. So I think that we need to secure definitely post-COVID, we will have better policies, especially India's investment in health was very, very low. It was negligible almost. So probably we will have better, health budgeting, better financial things. And probably we are hoping that we'll have the helplines which will be working properly, even though we have 181 helpline. But then there were a lot of females who said that they were not very much functional, or they had to call 10 times. So we need to have one-stop centers which will be functional. We need to have the justice mechanism for women. How can we expect that justice will be meted to a female when our political representation in parliament is just 12%? We need women as leaders who can change the policies. Even though a lot of things are happening, we cannot say that it is definitely better than earlier representation, where we had just 10% of the females in high representation roles. It has definitely gone up to 12%, but still I will see that we need to have key decision makers, females, are in those positions, in those political corridors, bureaucracy, wherein they can make policies that will be having more impact. I'm quite hopeful that post-COVID, we will look into these kind of interventions, and the government will secure the proper kind of financing for gender issues, gender developments, and we will have proper justice systems in place. That's it from my side.
Very hopeful. Thank you. Simi, please stay. Over to you.
Yes, ma'am. Thank you, Dr. Manorama Bakshi, for providing your insights. And in fact, once we are through with the panel discussion, we are having a number of questions from the participants, and some of them relate to the plight of the ASHA workers, and some of them can be posed to you. Thank you very much. I now invite Suhela for her comments, and welcome, Suhela.
Thank you, Simi. Thank you, Dr. Kelkar, and thank you, my fellow panelists, for throwing bringing in such rich perspectives into the issue. I just would like to begin by highlighting two positive trends that we are also witnessing at this point of time in COVID. One is definitely the fact that, and there have been research that has said that the crisis is likely to generate a large, if temporary, upward shift in men's participation in childcare, with a sizable fraction of married men taking the main responsibility in most cases for the first time. So this really gives a hope. Of course, the researchers pointed out that we expect that this shift to lead to a substantial increase in men's future participation in childcare. And the second positive thing that have emerged is this entire culture or work from home that we have been, advocating for since long, has now becoming a norm, at least for a large section of the workforce. We always considered the fact that women always wanted flexibility in their opportunities of jobs so that they are able to take care of the double burden. Of course, I mean, that is not something which has to be taken care of by themselves, but what they preferred is flexibility in their jobs. So now data shows that the number of work from home jobs posted at one of the job search portal for women has increased about 30% in the last 1 month compared with the same period a year ago. So these are some positive trends, but these would remain positive only if women feels safe at home, right? And the conversation that we are having right now is so pertinent because while we are happy that work from home culture is largely acceptable by organizations, by businesses, etc., it comes with its own cost of putting women's lives in danger, which we never ever wanted to. And I think we did not even realize that our push for flexible policies would lend us into the situation where there is a concern of the safety and life of women. So that is something which we need to have to undertake a nuanced analysis for. And thank you, Dr. Kelkar and others, to bring this topic into conversation, that yes, how important it is to deal with domestic violence. Now, what I'll also do is that during this a very brief talk, I'll also bring in a perspective of businesses and employers, because that is my area of work and I'm more comfortable to talk about that. But emerging data shows that since the outbreak of COVID-19, while violence against women has, particularly domestic violence, has intensified, and there a lot of conversation has already happened around that, and many women are being forced to lock down at home with their abusers. At the same time, the services to support survivors are being disrupted or made inaccessible. Dr. Bakshi pointed out the fact that there is a cost of violence to GDP. Yes, the global cost of violence against women was previously estimated at approximately $1.5 trillion. And now that we see the rise in violence, we can very well estimate that the figures would go up exponentially and continue in the aftermath of the pandemic as well. So before the pandemic, it was said that 1 in 3 women experiences violence during their lifetime. now many of these women are now trapped in their home with their abusers, right? And these are the case studies that have already been pointed out. That also means that within every workplace or even among a business organization's leadership team or a staff, there are likely women who are currently suffering from domestic violence. Why it does matter? Because addressing domestic violence has a human rights imperative as well as business case imperative, right? Violence against women is a violation of human rights and great impact on survivors and their families. At the business, if you would look at the business case, of course, women are less productive in the workplace when they suffer domestic violence. This results in significant loss of paid and unpaid work time, both employee turnover, poor performance, safety hazards, negative effects on workplace, interpersonal relationships. Not I'm trying to say that the unpaid work time is being reduced, which is bad thing. No, but we have to look at the nuances here. But data also suggests that where sexual harassment is more prevalent, average business profits are negatively impacted. So UN Women organized together with civil society groups. UN Women also participated in a webinar that was organized by leading CSOs in India. And there were few experiences that were shared on emerging data on violence during this pandemic. Of course, I mean, we have all read the report that National Commission for Women received complaints of violence, which have literally saw a twofold increase in complaints since the imposition of lockdown in the country. But what we also got to hear that the violence, the prevalence of violence during this pandemic, it's not just domestic violence, but also sexual violence, ethnic violence against women healthcare workers, as you have been pointing out. So there was a specific instances when in Delhi, Hyderabad, and Bengaluru, female students from Northeast India faced targeted attacks based on their ethnic origin, and they were verbally harassed, had objects thrown at their private parts, and their attackers shouted them as, referred to them as coronavirus. So why this has been aggravated at this point of time? Of course, there is a lack of redressal and response services. Our services were anyways, not too responsive or were very survivor centric, specifically one-stop centers. But at this point of time, yes, the women's helplines, shelter homes, and women's hostels that used to draw attention to have been, women are facing difficulties in accessing them because of this entire lockdown situation or being at home. Also, there is a gender digital divide, somebody pointed out, and lack of privacy and safe spaces to reach out to support is also was pointed out as one of the major challenge. And then increased load of care and household work, which leads to time poverty and leisure poverty, has adversely impacted their physical and mental health. That is also one of the reasons, that women are continuously feeling, their mental health is also deteriorating at this point of time. And then again, loss of livelihoods, jobs, man's lack of access to alcohol and substance abuse. This was also came as one of the points, is also resulting in anger and frustration. And man's loss of work, economic and food security, health anxieties, etc., were reported as important factors that are all contributing to an increase in women's experiences of violence at this point of time. One of the major things that was also discussed was the fact that most of the service providers that were priorly engaged in psychosocial counseling or those services that would enable women to come out of the situation are now diverted into relief work. So all functionaries, government departments, etc. So there is also a diverted attention from the agenda to other issues that are considered more important vis-a-vis versus domestic violence or violence in general. So these are some of the issues that were pointed out. Now, there were some recommendations that were made also at this point of time, that how you could one could try to work with the existing system to address some of these issues. So one of the recommendations that came up was that the services of violence against women and girls should be announced as essential services, so that the necessary resources that are required to be addressing these issues are not diverted. Again, there was. They said that there should be redeployment of spaces for violence against women survivors, fosters and shelter home, etc. And there should be a national level campaign, including advertising helpline numbers. We are increasingly seeing some of them coming up. So, but it should be on the level of washing of hands protocols through government-owned media, etc. And of course, the training of women health functionaries on violence should also be part of this. UN Women has recently also come up with tools for businesses that how they could address some of the challenges that their employees are facing at this point of time. And these are the practical steps for their human resources department, as well as their CEOs, to adopt a survivor-centered approach and build capacities of HR professionals and CEOs to recognize this and take action against it. I'll stop here at this point of time, and maybe would come into a conversation once we hear from others and questions. Thank you.
Thank you, Suhela, for pointing out very important information. And there's a lot to learn and there's a lot to share, actually. And it is by this platforms like these, I think, questions that really would raise the voice further, because the kind of questions and the kind of comments that we are receiving, they need, and we'll definitely come back to you during the Q&A. Thank you so much. So I now come to Dr. Indu Prakash. Thank you, sir, for sitting through patiently and listening to all of us. Please do not think that you are being, pushed to the end because of your gender. It is on gender. The theme is on gender. So we believe firmly on gender equality. So over to you. Thank you.
Yeah, no, well, well, I must first of all thank, one second. Yeah. One second, just, yeah. First of all, Govind Kelkar ji for having me here, because I was told by that, sir, she told that you have to be here. So it takes me back to the conference in 88. And she was one who, even at that point, had told that I was saying that men can be feminists. You don't have to be a woman to be a feminist, because it's a point of view take. So go was very supportive. Though there were some friends who said cannot be, we do that. See, the issue which I want to really bring up is, that during the, are you able to listen to me?
Yes, but in between your voice just broke away. So if you, I think now also there's some internet problem. If you could check your network settings.
Okay. One second. Okay. Yeah. Is it now better?
Yes, very.
Yeah.
Okay. So in a way, I want to just say that. Just a minute.
Should I take Indu sir over phone?
No.
Mobile also, which is further functioning. I want to just come quickly to what we've been discussing. Which is that during this COVID response, we were also part of the Delhi government's advisory panel for COVID response for food and everything. I was told by my colleagues in Center for Advocacy and Research, by Juhi and all, that Induji, in fact, we're getting lots of complaints from slums and all, that the wife battering cases is on the rise. And we should do something about it. So I think, so surely there were women's groups and all that were trained to deal with those violences and all. So I think that was happening, that was taking place. what also happened was, which I think came as a big shocker, was, when, one girl called me one evening from Kanpur. I won't name her because I think she could be listening to this program also. And that her father has been beating her for years at length. And during the lockdown, of course, because nobody can go anywhere, her mother was not in the city because of she's a teacher somewhere else in another city. And this is the first time actually, in fact, I've heard violences and all, but this girl who was being bashed by her own father, I think it was a big shock. And we tried to support her from organizations in Delhi. So I put up a small group to really work this out, and Shakti Shalini, the groups and all. Finally, Govind ji is also part of that. I set up a group on WhatsApp called No Beating Women Ever. And the day I put this group up, in the evening, I get a message from a friend that she, has been, she has left her family because she has left her family because, of the problems that she's facing in the home. Another friend called up saying that her husband has been abusive and she also has left the home. So, and in that case, since the neighbor was a Delhi police guy, she could escape from that place. And it was in Ghaziabad, by the way. So, all this actually brings to the fore that, at times women have been facing the worst in a society. Maybe that we get to know of certain cases because, of the contacts that we have or friends that we have. But these are only rumblings. These are mere, few things that we get to know as such. They might be, as the data says, 1 in 4, 1 in 3. I would rather say actually maybe it's more than actually that, and there might be cases where there's also child sexual abuse which must be on the rise. There's no study been done, but I know groups like Arpan and all working in places like Mumbai, where in the normal times they have reported child sexual abuse. We all know the data on incest and all those things. And much of this child sexual abuse actually has been happening in their own family. And in the child sexual abuse cases, it's happening both to boys and girls. So somewhere, this issue of why this happens, well, I must tell you that, I think we all know that. There was some question also by us certain friends here that, you're talking of, girls being troubled and all those things. But what about this daughter-in-law troubling mother-in-laws and all those things, issues as such? See, somewhere, I think, Govindji, this is taking us back to debate of 30 years ago. Like, we were very clear that whether the daughter-in-law, mother-in-law, the debate that we have, it happens because of the pathology of patriarchy. Because our society, it makes the male as a contender, and unnecessary, I think we have issues in the family because of the male dominance as such. So somewhere we need to rectify the problem in society, which is going on for a pretty long time. And I also feel, maybe that the increase during the lockdown of violence against women also tells us that maybe the structures that we have created in a society is actually ineffectual. Police doesn't bother about women. Laws may exist but doesn't handle problems. We have NCW and other bodies also. But the idea is that we need to be, why is it that you need to call the number and then somebody would intervene, and maybe even if suppose you go to the police station, they will not report the crime at all. These are moments when I think, apart from the larger issues of these issues also need to be tackled than being shelved under or maybe hidden under the carpet. As these issues, married women, whether it's single women, whether it's young girls, young boys, I think uh, everybody is facing the worst due to the patriarchal overload of a society. And surely, I think we need to deal with it by sensitizing the society. I think the same thing we were talking about 30 years ago is we need to again talk about in a big way. How is it that we can build solidarities amongst women as such, women's groups, empowering women in big way? How is it, that, in fact, there is no shame attached to talking about brutality, about violence that the women face in families, like still till date, I think if suppose the person has been bashed up, she would feel ashamed saying that I have been bashed up. No, as I think Govind is talking about, that even the women say, nahi, theek hai, chalta hai. Ek hi chata to lagaya tha usne, but chalta nahi hai ye. How can you justify violence as such in the families, So, or by a male for the matter. So I think my quick take on this entire thing is, that I think Govindji surely raised the issue about women's agency. We all were happy seeing how during the anti-CAA and anti-NRC protests, large number of young women emerged, large number of elderly women came, Shaheen Bagh and all. But all that, turned into a murmur the moment it became a lockdown, and I think she is going to give a very good reason, that how, patriarchal domination, shows its supremacist, ways of functioning and all that. I personally feel, that all these things has been happening in the society, or you're talking about, violence increasing during the lockdown period. It only shows how deep we need to really overhaul the society. We need to change the values of a society. Which justifies violence, which justifies bashing. And yes, I think, this friend of mine, Juhi from CFAR, also spoke about that. Indu please, ye jo liquor shops khule hai, isko band karwaiye aap. It's actually causing lots of problems, for large number of women, because the men are getting drunk and beating up, but for the government is revenue. Okay, for revenue, because so I think there are huge issues as such. For men, drinking is I think a matter of right for them. So I think for some of us who don't drink, who don't smoke, I don't think that is a necessity as such. But for some, I think it's a patriarchal assertion also that drinking as though is become a normal habit. And I personally feel that, I think we talk of male domination. We actually are a very sick society. We are a sick society, and we need to make less women and men also join this campaign and drive. I think things will not improve, and I think I'll try to end here, and then of course take up certain questions that come up. Thank you.
Thank you, sir. Thank you for providing your insights, and also for your efforts on social media, and to help the survivors of domestic violence, not just from the spouse, but also from others and other relatives. Thank you very much. I would now request Professor Kelkar uh, to go on to the next step of the panel discussion on taking a few questions that have been raised in the chat box. And yeah. Ma'am, you are on mute.
Thank you, Simi. I think a number of questions have been raised, and what I'm surprised that some stories have been told. A lot of it is written in Hindi, so somehow this can be. Before I go to questions, if it can be printed or distributed to us, that would be really important, because these are the kind of case studies of and women's statement, case studies of violence uh, in the present context, and how women have responded or not responded. They all have responded, but within the limits of that. So that would be the one important thing. As I see that either we how much time we have, because it is 6:39 now, and we 6:30 is already over. So do we have your permission, panelist and everybody, to go for up to 7 o'clock? Do you think that we can take some question answers up to 7? I can see some nods. Is that okay?
Yeah, sure.
Yeah, that's right. So then the questions are for kind of thing that one is I see the women's complicity, one major question, that women are also patriarchal, and they are also I वो भी भागीदार है. I can say in Hindi also, that is the in patriarchy, building patriarchy, reinforcing patriarchal attitudes, sometime kind of leading, either daughter-in-law leading the violence against women or mother-in-law leading the violence against women. That would be the this thing. And of course, I like this word predator is at home, or the home is spheres of kind of this thing. But this is the women's perception, really, is a kind of thing, whether we define however soft we might be. That is another question that is a need to be addressed. Another question is, third question is raised, which is raised probably to me, that well pointed out issues very well, but will take centuries to bring a small change, breaking masculinity and patriarchy. So I would take this question first. Is that okay? That is the this thing, but I don't think that uh, it will take centuries. I mean, if I can be allowed a little bit freedom in terms of dealing with the religion, the general perception is that there is so much parda, there is so much backwardness, and kind of among Muslim women. Okay. And I visited several times Shaheen Bagh. And I was so impressed with the articulation, the control that they led the movement in Shaheen Bagh. And this was really women's issues, and that were more kind of political issue. It was a political issue. So this is the agency that we are talking about, Pinjara Tod. Why the Pinjara Tod activists are being arrested, kind of thing. So this is the attack on patriarchal state, patriarchal market, and patriarchal household system. These are the young women who are fighting. This is the change that we see. That is, so I don't think that we would be really, these women are going to continue. Of course, change would be not at a kind of, there would be some changes, and we will go up and down. So it is not unilinear kind of change that we are talking about, that there is bound to be change. That is my understanding. I have been very kind of happy, because in my early days, and there where sometimes age is of some benefit, there were the questions, that question of rape, question of domestic violence, they were the tabooed area. They happened, but they were not being talked about. Now we can debate on these issues, we can talk as the subject. Now this is a change. We are dealing with this kind of issue, and that need to be addressed at national, subnational, and international levels. So this is important. Why World Bank should be in conservative, hardcore economic institution? Why it should talk about the violence against women? Because this is the issue that has become a part of the economic development, part of the development. Now, this is the change that we are seeking in terms of women as you recognize women as producers. Unless you make women, accept women as producers, you are not going to develop your economy. So that is what is happening in terms of, so change is going to happen. Second question also was raised to me, that is about, and then I'll take the other panelists and the questions. about women's complicity. Of course, there is women's complicity, because if you see the history of colonial India or any other colonial kind of thing, uh, all those who perpetrated violence on women and men were not really all of the British origin. There were Indians also doing it. Okay, so we also imbibe those values, and that is really justifies our existence. So women also tend to accept kind of thing, their complicity, but complicity is not the same as the active generation of that one has to realize that it would be the, and the power struggle also. We don't think that women are babies. Women are human, and we want human rights for them. That is the thing. There will be mistakes, movements also make mistakes, there may be kind of other things also, but our struggle is really for human rights for women. That is the kind of economic rights, political rights, rights of dignity, and rights of, and the fundamental thing in that is really land and housing for women. If the houses are, there have been couple of studies, when the house and land are in the name of women, then there is minimal violence that is there. Nobody tells them either you adjust or get out, kind of, neither mother-in-law nor husband nor anyone else. So that is the, these are also, but along with this, I think sensitization has to be accompanied in my analysis by economic rights, assetless, from making them from which they are now, from their assetless position to asset holders. That would be important, that we need to recognize. There may be one case of this which Dr. Manorama pointed out about this principle. I know some IAS women also, IAS officers, husband and wife both being IAS officers. Similar situation kind of thing earlier. When I was in uniform, I was narrated about this. But the question, everybody is not like this. Some people, some kind of, for reasons that they are there, that the kind of thing, you have to buy a house, you have to have status, and but these are the incidental cases. We are dealing with the really 99% of the cases, and there the pattern is different. These are the two issues that I wanted to address. And third one, the request is that I would ask the audience what would be the, those who have said in the chat box, can you please raise any other issue that is there to the panelist or anyone?
Ma'am, there is a question that can be directed to Suhela, where one of the participants has mentioned, apart from the entire narration of the way she is dealing with violence in her own household, despite being an educated and working professional, she has, due to the lockdown, she has been locked up in the house and in the room, and has been faced with endless violence. So this has completely shattered her emotional and her sensibilities, and has also negatively impacted her work productivity. So this is not just for women who are homemakers, but also for those who are working. So your thoughts on that?
Suhela, please.
Thank you so much for the question, and yes, I completely can empathize, because this issue is not only with homemakers; it is with all women, irrespective of the fact that whether they work, they are at home, they are they are working in factories, they are working in companies and boardrooms, etc. So this is not an isolated kind of issue, and it impacts all women alike. Having said that, I'm not sure what mechanisms are you trying to adopt to be able to address this situation. Do you have access to the HR of your company? Do you have access to your supervisor whom you can speak to and try to see what is available to you as a resort to be able to address this issue?
Thank you, Suhela. The next question.
No, Suhela's question, Suhela, there was also a question to you.
Oh, okay.
You can see that productivity. Women work from home, the productivity is affected. It becomes half. So that is also one of the things, because these positive trends that you pointed out, that question was there now. I saw that. Can you address that?
Sorry, I didn't get the question. Can we have the question again, please?
That if you work from home, you remember you suggested two positive trends. One is that working child in the child care. Second one is that women wanted flexibility and they can work from home now. Home work will be possible.
Right.
The question is whether the working from home will affect
reduce the productivity. Okay, no, I mean, okay, sure, no. This is the personal experience that we would like to share across. I mean, I think we are working so productively during this lockdown, and I think this would resonate to most of us. The fact that, and there have been an increasing realization, and there have been, data out there that the work from home is not affecting productivity at all, and this has been recognized by companies. I think the way we have to the important thing is that in companies, there is, when you go to office to work, there is a constant effort on monitoring your work hours to be able to link it to the productivity. But now what there needs to be a slight shift in that that comprehension of your productivity and work. What is required is to see that it doesn't matter, that the number of hours doesn't matter, it's eventually the output. So you have to move from to the approach where you are not counting the number of hours, but looking really at the output that has been created. And there has been a realization of the fact that during the lockdown, work from home, there has been not a negative impact on productivity.
Thank you, Suhela. One person who has raised the question is, if I call her Pooja Kumari, and she has raised to very panelists and attendees, to all of them, is really the kind of, she is saying that हालांकि आंकड़े के निश्चित रूप से एक समग्र तस्वीर का प्रतिनिधित्व करते हैं, कुछ व्यक्तिगत वास्तविकताएं हैं जो हमें अपने से अलग करती हैं और हमें उस तरह की पीड़ा और निराशा की भावना देती हैं जो उन लोगों में व्याप्त हैं जो जीवित या लिंग आधारित हिंसा से जूझ रहे हैं. हम आपके साथ साझा कर रहे हैं लॉकडाउन के दौरान रिपोर्ट की गई कुछ वास्तविक कहानियों के साथ जिनमें सावधानी के लिए लोगों के नाम बदले जा रहे हैं. She has given number of kind of that is the request was that they should be shared with us to Simi. But what a question she is raising is implicitly, and Pooja, you agree with me, क्या आप ये कहना चाहती हैं कि हम लोग थ्योरी की बात कर रहे हैं और जो औरतों के साथ हो रहा है उससे ये जुड़ा हुआ नहीं है? क्या आप ये कहना चाहती हैं? तो बता दीजिए. आप वहाँ सुन रही हैं पूजा कुमारी जी?
मैम उनका रिप्लाई का वेट करते हैं, तब तक दूसरे पे चले जाते हैं.
अच्छा, ठीक है.
So, ma'am, if I can pose the next question, I'm collating the next question to Indu sir. And sir, there are a few comments that are being raised that things like 181, the helpline numbers are not functional. The police are usually seen to side with the men. Domestic violence is all about the power game, and it is also said that when the women raise their voice or even complain, the intensity of the violence in the household it increases. Your thoughts, sir?
Yeah, no. In fact, are you able to listen to me?
Yes, much better, sir. Yes.
Okay. Yeah. So, I think the question that is raised, I think it's a perfectly valid question. There's no dispute on that. The simple reason that people were reaching us, then calling the police and other people, it only showed that they had more faith in the social activists and people that they could reach. So my contention was, that we are just a sprinkling of people. 1 or 2%. When the government has got a huge system, the entire system had collapsed. So all your police, all your law, all your commissions for women, where are they? Do we have to have a WhatsApp group to handle violence against women, such a serious issue? So I think somewhere I personally feel that as a society, which is totally patriarchal, pathological, sick society, we need to, I think, overhaul our systems. We need to say clearly that this is a male-dominated society. And in fact, I believe I've been, I've been seeing comments from Sudha Sachdeva, who she's saying that she's locked in a room and she'll be taunted later. There'll be so many Sudha Sachdevas as such. There was one issue about, what do you talk about in Kerala? It's been very nice. They've been able to handle COVID. How about women's issues in Kerala? Well, I remember even during the earlier times, we've had suicides of girls in Kerala also due to dowry as such, So if you're talking of patriarchy, well, it might be to a lesser degree there, but that the patriarchy is not there is, I think, a misnomer, a miscalculation. So my entire take on this, Govindji, would also be, that I think, somewhere, of course, women's organizations, women's mobilizations has got institutionalized in women's organizations and all. Somewhere, I think, the flavor of the movement which was there in the 80s, 70s, 80s, and 90s, we need to bring it back. And I know the promise lies in some of the young women leaders I saw, whether it was Jannat Farooqi, in Jama Masjid, Suhela, and these young, people whom the police is arresting today, the Pinjat Tod girls and all. I think they are the women who are leading the country. And today I honestly would say, our government, our union government, which is thoroughly patriarchal, Hinduized government, needs to deal with this issue frontally. When Swami Chinmayanand, Kuldeep Singh Sengar, these criminals are let loose, it sends a wrong signal. This girl in Kanpur is petrified to go to the police because she says that, sir, police will not listen to me. My father who's been bashing me up, she has tried to throttle me umpteen number of times, I'll get killed. So now what? And then the women's organization there in Kanpur, they're not doing anything about it. So thankfully, we've got some advocates in Kanpur, and through the group, we are trying to support her. But the only issue is the formal system that we've had till date, I think they have been crumbling and collapsing. So we would need to entrench them, empower them, and form, I would say, small solidarities of women, of men who are progressive, who are opposed to patriarchy. It's doable. I don't think so we require another 100 years. We can deal with patriarchy today and now itself. The only thing is we require the will to do it. And our institutions are not prepared. So I think we would need to get hold of institutions, shake them, whether judiciary also. Judiciary today is stupefied. So which institution today in the country is working, by the way? Nothing. So that's the reason why I think women are facing the worst, because there's a total institutional collapse, legal collapse, societal collapse, and systemic collapse, And like as in the US, race is dominating, similarly caste is dominating, atrocities against Muslims and Dalits is dominating, and what happens to women, I think, is the worst. And in families today, that's what we are seeing today, So I think it's an overall, I think, decay and crumbling of society. We need to create newer structures, stronger structures, build more solidarities and communities of people as such to deal with this, Yeah.
Thank you, sir. I will just wrap up. The last question I would I would ask Dr. Bakshi to respond. Just in brief, where it is written that during the lockdown prior to COVID, there were reports that women's participation in the labor force had declined substantially. Do you think that work from home has reversed this? Perhaps Suhela can also add after Dr. Bakshi's brief remarks.
I think she has rightly said, because if you will look at the organized sector women participation labor force, that has declined from 33% to 25%, 24, 25%. So the person who has put this question is right in saying so, that it has declined. And the reason of decline that has come in report was that women were not with their wages that they were being offered. They were not at par with the men. Their work hours was at home. They were expected to do the household chores. These were some of the recommendations and of that report, which had shown that there has been decline in women labor workforce participation. And these were some of the reasons they had said that since female labor workforce participation is on decline in India, the reasons are woman has now double burden of doing the household chores and outside work also. At the same time, they are not paid equal wages with the men. So these were two major things. And when talking to your second point, what you said about the lockdown period, like whether it has increased the burden on women. And like one female, she has been constantly sending, different segments and different strata of women have different things. Like I will give you my example. Like after doing the household chores, I sit till 11 o'clock. But we have the facilities like we sit in AC rooms. Same is not the case with maybe some other females. Like, so we have to look into the segment and strata. I have seen the females wherein elderly care also they have started doing. Children's are also at home, and for them, like they are not that much productive. Like they have not been able to, when they go at least to office, they are more productive there. While as at home, when they have the elderly care to take care of, children are also not going to schools, they have not been that much productive. So it depends upon the segment of the females we are referring to.
Thank you, ma'am. Suhela, would you like to add?
No, I don't have anything to. Thank you.
Thank you so much. And Professor Kelkar, we are through with the session today, and I would like to invite you for the last few sentences, if you could, and then Arjun would give the vote of thanks in a couple of sentences.
I think one sentence or two sentences I wanted to tell all of us, okay, because I'm in the same boat as you are, and probably experience a lot of things similar to what women are facing. That is that we should never stop thinking why this is happening. That is why question is important, because unless we diagnose the problem, then only we can correct it. So it would be really important to think what is this nature of patriarchy, which is making us subordinated and the other one as the dominant person. Okay, how we can defy these social norms at any cost in the little ways, that is what kind of thing. This is the lesson we can learn, and probably we can, of course, have the empathy. That is all kind of support is needed, which probably we are doing that. So we should not really even denigrate those women who kind of implicitly accept or explicitly accept violence, because there may not be any other place to go. So this is a deeper understanding is needed on all, whether as activist or as a development worker or as a researcher in our own field. So that is how we can do that, both women and men. That is how I'll sum up that this is kind of lesson that we want. Things are changing. That is my second point. I think we should not give up the hope that things are not changing. If we give up the hope, then what are we doing? We are really defeating ourselves. That means people who have worked like 30 years, 40 years, a kind of thing. Some of them may be young, some may not be young. That means that we are not going to make change. No, we are making change. That is not really, but not enough change. And that's why we need to push harder. That is what, and that's why these Claiming the Night, Pinjra Toro, Shaheen Wagh, these are very good examples to all of us to know that how women's agency and how they are questioning the state, and how once they question the state, once they question these things, these are women not will accept male authority in their homes. I have seen them addressing the male authority in that kind Shine Wak case. That's why I'm so. I think I'll like to kind of ask for Simi, to you over, who is going to give the vote of thanks. The panelists are getting late. Thank you.
Thank you so much, ma'am, for wonderfully summarizing the entire session, and it has been really productive. And before, so now I would just request Dr. Arjun Kumar to end the session with his vote of thanks.
Thank you very much, Simi. Very stimulating session with the kind of taking the cue from what Professor Kelkar said, that the immense experience of the panelists and the work of their lifetime. We have to continue that, and change is happening. Not enough, as ma'am has rightly put out, and other panelists also. Let me thank everyone, organizers, panelists, those who have been able to attend, and those who have not. Will post the video on YouTube very soon. Let me thank our chair for the panel, Professor Govind Kelkar, Dr. Manorama Bakshi, Suhela Khan, Dr. Indu sir, always fighting for the cause, and this is the spirit which makes us believe that change is happening, and there is a person behind it, not male, not female, and we are striving towards that, and we will continue to do so. Very good suggestions. If I can sum up, Professor Kelkar highlighted that the issue of unfreedom and freedom, work and acknowledgement. Manorama ma'am rightly pointed out and highlighted April 11 Motherhood Day. In fact, I talked to her that day, and those chats and those discussions leading to these kind of deliberation which we are doing today. Very rightly, she has pointed out the real question that why elected representation is not accepting the women reservation bill, and why it is not being getting there. Suhela ma'am rightly pointed out and highlighted that in the sphere of work, business, these are necessary thing, having gender balance. Indu sir has said so many things, but most of all, the overhaul of system, the envisaged vision of New India has to take these suggestions. Otherwise, this New India will again be a marketing, and not the New India India is seeking for, young India is seeking for. I'm very thankful for the panel for choosing and speaking over economic rights, especially for women. And I would highlight that wherever we go, in any nook corner of the country, barring some of the areas which are rich, there only you can see women participating in the market as stakeholder of market, not just as a customer. If we go to developed nation, there we will find more participation of women in cafeterias, in all sphere of market. So other than the elected representation in market, we should be having more women, and again the freedom, unfreedom, and the kind of thing Professor Govind is highlighting, that should be done. Let me congratulate our Gender Impact Study Center for choosing this topic and doing this event. I remember Professor Govind Kelkar telling to me that we should do it on a Monday, on a work day. It's not a side issue. This is something we should do on a work day, so that this is into our working hours, into our conscience. And these are the issues on which we have to work to make, this is the real nation making exercise. So any claim that this is national, anti-national, and this issue important and not, the economic empowerment of our 50% of population is certainly important, and I'm very thankful. For the next coming Mondays also, we'll take this theme, and our Gender Impact Study Center would do more this kind of deliberation, lectures, this kind of panel discussions. We will also try to bring the real stakeholders to come here, speak, police officers, those who are operating these toll-free numbers, those who are complaining, we will try and do so with the help of our excellent researchers and our network people. Lastly, I would also, like to say that IMPRI is a platform for proactive, independent, non-partisan, and policy-based research. And our mandate is to engage in such debates and deliberation for action-based solution and policy changes. And we would continue to do so. Adding to that, as you know, this crisis, everyone is saying that do this, do that, this is for your personal safety, this is for your personal family thing. But working on these issues, we should forget about, any specific person or us or family, but rather demonstrate that we are working for our time and our space. We will be a part of history after this crisis. And in India, wherever we are, we have to demonstrate that what we have done and how strong we are making as a collection of people in India and in world, what contribution we can give. And lastly, I would like to thank Anshula, Ritika, our research director, Professor Balwant Mehta, Simi very much. And I hope that we will have more such engagement and deliberation from our Gender Impact Studies Center. Thank you, everyone. Have a nice evening.
Thank you. And before we just sign off, can I just request Anshula and Ritika to turn on their videos? I'll just take a screenshot of the panelists, please, quick. Balwant sir, if you can. Okay. Ma'am, are you ready? Okay. 1, 2, 3. Thank you. Thank you so much.
Thank you. Thank you.
Thank you.
Bye.
Have a nice evening, all. Thank you. Bye.
Thank you all. Thank you all.
Have a nice evening. Good night. Bye.